Ever wondered what those painful sores in your mouth are? Well, you're not alone. These little nuisances are known as canker sores, or in more scientific terms, Aphthous ulcers. They're small sores that pop up inside the mouth, usually sporting a white or grey centre surrounded by a red border. Yes, they can be quite a pain, especially when you're trying to enjoy a meal, have a chat, or simply brush your teeth. But here's some good news. Canker sores are not contagious. That's right, you can't catch them from or pass them on to someone else. And while they can be quite bothersome, they don't pose a serious health risk. So, what causes these little intruders? The exact cause is a bit of a mystery, but they seem to be influenced by factors such as stress, mouth injuries, hormonal changes, and nutritional deficiencies. So let's dive deeper into understanding these pesky little sores. What causes these painful sores in your mouth? A question that has perplexed many, given the discomfort and inconvenience these little ulcers can cause. Canker sores, medically known as Aphthous ulcers, are a common oral problem, but their exact cause remains elusive to researchers. However, several contributory factors play a significant role in their development. Let's delve into these factors, shall we? First up is stress. Yes, the same culprit behind many of your sleepless nights and headaches. Stress can wreak havoc on your body, and your mouth is no exception. When you're under stress, your immune system may falter, creating an environment where these sores can thrive. Next, we have mouth injuries. A simple bite on the inside of your cheek or a brush with a sharp object can cause a canker sore. Even aggressive toothbrushing or dental work can sometimes lead to these pesky ulcers. So be gentle with your mouth, it's more sensitive than you think. Then we come to hormonal changes. Fluctuations in hormones, particularly during menstruation, can trigger canker sores in some individuals. This is likely due to changes in the body's immune response during this period. Lastly, let's not forget nutritional deficiencies. Lack of certain vitamins and minerals like vitamin B12, iron and folic acid can increase the likelihood of developing canker sores. So maintaining a balanced diet is not just good for your overall health, but it can also help keep your mouth ulcer-free. While the exact cause remains a mystery, there are certainly factors that can trigger their occurrence. Understanding these triggers can help in managing and potentially preventing these bothersome sores. So, keep an eye on your stress levels, be careful not to injure your mouth, pay attention to hormonal changes, and remember to eat a balanced diet. Your mouth will thank you for it. Did you know there are different types of canker sores? Just like the many hues in a rainbow, there exists a variety in the world of canker sores. Let's delve a little deeper into the three main types of canker sores: minor, major, and herpetiform. Minor canker sores, as the name suggests, are the least severe. They're small, oval-shaped, and usually heal within 1 to 2 weeks without leaving any scars. They're the most common type, often making an unwelcome appearance during times of stress or hormonal changes. On the other hand, major canker sores are the heavyweights in this category. They're larger and deeper than minor sores, with irregular edges that make them easily distinguishable. Unlike their minor counterparts, major sores can take up to 6 weeks to heal, often leaving behind a scar. These are the kinds that you'd want to get checked out by a healthcare professional, as they can cause significant discomfort and interfere with everyday activities like eating and talking. Now, the third type, herpetiform canker sores, might sound like they're related to herpes, but don't let the name fool you. They're not caused by the herpes virus. These sores are peculiar, as they appear in clusters of 10 to 100 tiny sores, often merging into one large ulcer. Despite their intimidating appearance, herpetiform sores heal without scarring, much like minor canker sores. So there you have it, the three types of canker sores. Each has its unique characteristics, from size and shape to healing time. But one thing they all share is the ability to cause discomfort. Each type of canker sore has its unique characteristics, but they all share the common trait of causing discomfort. How are canker sores diagnosed and treated? Let's delve into that. Identifying canker sores is typically a straightforward process. Thanks to their unique appearance, a white or grey centre surrounded by a red border, they are quite distinct. Most of the time, a healthcare professional can diagnose a canker sore simply by looking at it. This visual examination is usually all that's needed to confirm the presence of this common oral issue. However, in certain situations, additional diagnostic tests may be ordered. This is particularly true for cases where canker sores are frequent or refuse to heal. These tests help rule out other potential underlying conditions that might be causing the sores, ensuring a correct diagnosis and thus the most effective treatment. Now, speaking of treatment, let's take a moment to discuss the healing process and the options available. Canker sores, for the most part, are self-limiting. This means they resolve on their own without any specific treatment. Most minor canker sores will heal within 1 to 2 weeks. That said, the healing period can sometimes be uncomfortable. Over-the-counter treatments can help manage this discomfort and potentially even speed up the healing process. These remedies often come in the form of topical gels, creams or ointments that can be applied directly to the sore. They work by numbing the area, reducing pain and irritation, especially during activities like eating or brushing teeth. In addition to these treatments, lifestyle modifications can also be beneficial. For instance, avoiding spicy or acidic foods can prevent further irritation of the sore. Similarly, maintaining good oral hygiene can help keep the area clean and prevent secondary infections. If you're dealing with a severe or persistent outbreak, don't hesitate to reach out to a healthcare provider. They may prescribe stronger medications that can either be applied topically or taken orally. These are usually reserved for more severe cases and can significantly help in managing symptoms and promoting quicker healing. But remember, while these treatments and strategies can help manage canker sores and speed up recovery, they do not necessarily prevent new sores from forming. That's why understanding the potential triggers and practicing preventive measures is also key. Most canker sores will heal on their own, but there are ways to speed up the process and ease the discomfort. That's the takeaway here. Armed with this knowledge, you can face canker sores with confidence, knowing how to manage them effectively and take care of your oral health. Can we prevent canker sores from developing? This question might have been hovering in your mind since the beginning of our discussion. Well, while there's no definitive way to completely prevent these pesky sores, there are certainly some measures we can take to reduce their likelihood. First and foremost, maintaining good oral hygiene is crucial. This involves regular brushing and flossing with a soft bristled toothbrush to avoid causing any unnecessary injury to your mouth. It's also recommended to use toothpaste and mouthwash that doesn't contain sodium lauryl sulfate, as this ingredient can sometimes trigger canker sores. Next, it's important to be mindful of what you're putting into your mouth. Certain foods, particularly spicy, acidic or sharp foods like nuts and chips, can potentially lead to mouth injuries and trigger canker sores. If you notice that canker sores often appear after consuming certain foods, it might be worth avoiding them. Stress management is another significant aspect of prevention. Stress can weaken our immune system and make us more susceptible to canker sores. Therefore, implementing stress management techniques such as regular exercise, meditation, or even just taking time out for yourself can be beneficial in preventing canker sores. Furthermore, maintaining a balanced diet is essential. Nutritional deficiencies, particularly in vitamin B12, iron and folic acid, have been linked to canker sores. Therefore, ensuring your diet is rich in these nutrients could potentially help to prevent them. Last but not least, if you frequently get canker sores, it might be worth consulting with a healthcare professional. They can help identify any underlying conditions or medications that may be contributing to their development and suggest appropriate preventive measures. So, although there's no foolproof way to stop canker sores in their tracks, these proactive steps may help to reduce your risk. Remember, prevention is always better than cure, and taking care of your oral health should be a priority. While there's no surefire way to prevent canker sores, these steps may reduce your risk. What happens if canker sores get worse? That's a question that often crosses our minds. While canker sores are generally harmless and usually heal on their own, there are a few rare complications that can arise. These include infections and scarring. Infections can occur if harmful bacteria enter the open sore. This can lead to further discomfort and, in worst-case scenarios, the infection can spread, causing other health issues. Scarring, on the other hand, is more likely to occur with major canker sores that are larger and take longer to heal. These scars can cause discomfort and affect your ability to speak or eat. So how do we cope with these painful nuisances? First and foremost, managing pain is key. Over-the-counter treatments can provide temporary relief. Rinsing your mouth with a mild over-the-counter mouthwash or a salt water solution can also soothe the sore and accelerate healing. Maintaining good oral hygiene is another vital coping strategy. Regular brushing and flossing can prevent bacteria buildup, reducing the risk of infections. However, be gentle around the area of the canker sore to avoid further irritation. Even with these coping strategies, it's crucial to pay attention to your body. If your canker sore is particularly large, lasts for more than 2 weeks, or is accompanied by severe pain or high fever, it's time to seek medical attention. Doctors can prescribe stronger treatments or even identify underlying conditions causing frequent sores. Living with canker sores can be a pain, but remember, it's crucial to seek medical help if things get out of hand. Now let's address some common questions about canker sores. Question 1. What exactly causes canker sores? While the exact cause is unknown, several factors may contribute to their development. These can include stress, mouth injuries, hormonal changes, and nutritional deficiencies. It's a bit of a mystery, but these factors seem to play a significant role. Question 2. Are all canker sores the same? No, they are not. There are 3 types of canker sores: minor, major, and herpetiform. Minor sores are the most common, healing within a week without leaving scars. Major sores are more severe and can take longer to heal, possibly leaving scars. Herpetiform sores are the least common and appear in clusters. Question 3. How are canker sores diagnosed and treated? Canker sores can usually be diagnosed by visual examination. If you frequently get canker sores or have one that isn't healing, your healthcare provider may order diagnostic tests. Most canker sores heal within 1 to 2 weeks without treatment, but over-the-counter treatments and lifestyle modifications can help relieve symptoms. For severe outbreaks, prescription medications may be required. Question 4. How can I prevent canker sores? Good oral hygiene and avoiding triggers such as certain foods or stress can help reduce the risk of canker sores. It's about being proactive and taking good care of your mouth. Question 5. What complications can arise from canker sores? While complications are rare, they can include infections and scarring, especially with major sores. If you experience severe pain, an unusually large sore, a rash, fever, or sluggishness along with canker sores, you should seek medical attention. Question 6. How can I manage the pain and discomfort of canker sores? Over-the-counter and prescription treatments can help manage pain and speed up healing. Rinsing your mouth with a mild over-the-counter mouthwash or a salt water solution can also provide some relief. Avoiding spicy or acidic foods that can irritate the sore can help as well. Remember, understanding canker sores is the first step in managing them effectively, so keep your mouth healthy and stay informed.